Diabetes by Pam Campbell. Hull's Human Anatomy and Physiology defines diabetes as a metabolic disease that arises from lack of insulin or inability of cells to recognize insulin. There are three types of diabetes: type 1, type 2, and gestational diabetes. Type 1, sometimes referred to as juvenile diabetes, can happen at any age. The primary characteristic defining type 1 is the lack of insulin produced by the pancreas. The patient therefore needs an insulin replacement. Type 2, also referred to as adult onset diabetes, affects how the body can process sugar. A person with type 2 diabetes doesn't produce enough insulin, or their body resists the effects of insulin. The third type is gestational diabetes. As the name implies, diabetes during pregnancy. This type generally returns to normal after delivery of the baby, but predisposes this person to type 2 diabetes. There are several symptoms related to diabetes, and all three types have several of the same symptoms, and they are as follows. First, polyuria, which is frequent urination. Polydipsia is an excess thirst. Blurred vision, hunger, fatigue, weight loss or gain. Cuts and sores that won't heal, areas of darkened skin, dry mouth, itchy skin, yeast infections, and pain or numbness in lower extremities. If these symptoms are left untreated, they can lead to more chronic long-term issues involving the nerves and vascular systems. Other predisposing factors for type 2 include obesity, lack of exercise, fat around the abdomen, polycystic ovarian disease, gestational diabetes, family history of diabetes, and race. Evidence shows that African Americans, American Indians, Hispanics, and Asian Americans have a high risk of developing type 2 diabetes. There are several tests that can be done to diagnose diabetes. The New England Journal of Medicine recommends early screening so that preventative steps can be taken in regard to lifestyle changes. These tests include, but are not limited to, the glucose tolerance test and a fasting blood sugar. But the most reliable, for better look back, is the HbA1c. National Institute of Health defines A1c as a blood test that provides information about a person's average level of blood glucose over the past 3 months. The technical definition provided by Mayo Clinic is glycated hemoglobin is a form of hemoglobin that is measured primarily to identify the 3-month average plasma glucose concentration. A non-diabetic normal range, A1c, is 5.7%. The first case of type 1 diabetes ever mentioned in historical documents occurred in 1552 BC by an Egyptian physician referred to as Hesi Ra. The cause of type 1 diabetes is unknown. Type 1 diabetes is an autoimmune disease that is characterized by the body attacking insulin-producing cells. Type 2 diabetes, the cells are resistant to the action of insulin. The term distinguishing between type 1 and type 2 did not occur until 1936 in journals in diabetic medicine. Type 2 diabetes is known to be a metabolic disorder. Gestational diabetes, the placenta produces hormones for the pregnancy and they make your cells more resistant to insulin. The prognosis for diabetes is a myriad of health issues. There are acute and long-term problems associated with the disease. Acute problems are hypoglycemia, which can vary from each individual. Symptoms are from mild, shaky to jittery or extreme to convulsions and coma. Second is diabetic ketoacidosis. Symptoms are excessive thirst, weakness or fatigue, shortness of breath, frequent urination, fruity scented breath, and confusion. Home tests are available to purchase that can be used to monitor elevated blood sugar and high ketones in the urine. Long-term prognosis of untreated diabetes not kept under control include, but are not limited to, vascular problems, developing peripheral nerve damage, diabetic retinopathy, and hypertension. Nerve damage, in turn, leads to bladder incontinence, impotence, and diarrhea. Untreated, uncontrolled persons can also have lowered immune system, leading to the risk of infection due to nerve damage and undetected wounds. There are several groups of medication used to treat diabetes. Insulin was discovered in 1921 by Sir Frederick G. Banting, Charles H. Best, and J.J.R. MacLeod. By testing on dogs, they discovered insulin and how the body uses it. The insulin process was further developed by James B. Collip, and the first dosing was done January 11, 1922. The first medical success was on a boy near death at age 14, Leonard Thompson. Treatments brought him back from near death. There are several ways to treat diabetes in conjunction with medications and insulin. First would be the change in eating behaviors, and to set aside a time for physical activity. Counting carbohydrates is one form of keeping a diet in check, but an easier option is the plate method. This allows the person choices in all the food groups in smaller portions, not measuring, but by using a 9-inch plate and dividing it in half for non-starchy vegetables, then 1/4 of the plate for a lean meat, which if measured should be about 3 ounces cooked, and 1/4 of the plate with starchy vegetables or a whole grain. Complete the meal with 8 ounces of fat-free milk and a serving of fruit. Walking and strengthening exercises are a good option for activity. In conclusion, treatment for diabetes is a difficult journey. It is a lifelong journey for type 1, requiring discipline and balance. For type 2, it is a change in lifelong habits, all bad. It too requires discipline and balance. And for the gestational person, that is already disposed to developing type 2, the most prevalent and fastest growing disease in the United States. It is important to maintain an active and clean lifestyle, free of smoking, abundance of alcohol, and obesity. Thank you.